My name is Dr. Ary Krau. I'm a board-certified plastic surgeon. I've been in practice for over 21 years. I have my private practice in Bay Harbor Islands. I also work in probably what is the busiest plastic surgical center in the United States, which is called CG Cosmetic Surgery. We do a lot of surgery over here. I think it's a great place to have surgery because I think there are a lot of good doctors over here, including myself, if I may say so, with a lot of experience, and we're very price competitive, and that's one of the advantages of coming down here. We actually perform more than 400 surgeries per month amongst 3 of the board-certified plastic surgeons in the center, which is good for patients, it's good for us, it's good for the overall plastic surgery because I believe we provide a good product at very competitive prices. Florida and Miami in particular is very competitive as far as being able to offer patients experienced plastic surgeons at a very affordable price. And that's because we compete not only with the United States and our close neighbors, but also with South America. And South America prices drive the prices down here in Miami. So if one wants to, let's say, get a good deal for surgery, of course, without sacrificing the safety and quality, I think they should definitely look at places such as this, CG Cosmetic Center here in Miami. As far as what I bring to the table, I've been in practice for now over 21 years. I happen to be a lead physician, LEAD, where there's only about 35 of us that are a group selected by the Mentor Implant Company for those that provide leadership, education for breast augmentation. And we're consultants for the implant company. They chose us because we have the most experience and we do more breast augmentation procedures, including breast lifts, than other physicians in the country. So we're a small echelon of plastic surgeons that have been selected for our experience and the quantity of breast augmentation procedures that we perform. Breast augmentation and breast lifts in particular is one of my niches. Although there are other procedures that I like, particularly rhinoplasty and of course the whole gamut of plastic surgical procedures, all the cosmetic procedures. But as far as breast augmentation and breast lifts in particular, I have a particular technique that I'm very proud of. Generally speaking, patients know about implants being placed behind the muscle or in front of the muscle. But there is a layer that I think is the key to performing good surgery, and that is the fascia. And that's the fascia over the muscle. And that fascia really should not be violated and should be respected. And that's what gives implants a good shape, and that stable shape with very low rate of displacement, very low rate of capsular contraction, basically very low rate of revisions. I personally perform more than 1,300 breast augmentations a year here at CG and in my private practice, and we have a very low complication rate. Our capsular contraction rate is less than 1%, which is as low as you can make it. The other niche that I am proud of is my implants with lift. The augmentation mastopexy is known to be the most complicated, they say, cosmetic breast surgery, and that's because, generally speaking, the two forces, meaning the implants and the lift, work against each other. And unfortunately today, a lot of the lifts that are still performed are a skin operation, and I think that's a bad operation personally, because the skin is not really a good vehicle to hold the breast up. If one uses the skin to lift the breast, and that's, I believe, what is unfortunately done too often, meaning that you cut out extra skin and you tighten the skin and that pushes the breast up, that really doesn't work well because first of all, the skin stretches very quickly and all the tension is relied upon the skin. And what winds up happening, the skin stretches and the scar stretches and you wind up having bad scars. The key to performing good scars is basically tension-free closure. That means there shouldn't be any tension on the skin, so therefore you cannot use the skin alone to lift the breast up. Instead, if you again go inside the breast and operate on the fascia and reconstruct the breast from within, that breast gets lifted up from within and the skin just follows. There's no tension on the skin line itself. Those scars are as good as they can get, and within a relatively short period of time they become pretty inconspicuous. So if you look at the quality of the scars on breast lifts using techniques that I use as opposed to techniques that perhaps others use on skin-only procedures, there's a world of difference. It's almost night and day. You could see lifts that have been performed with a skin lift, those scars are red, they're thickened, there's tension, they just look angry, as opposed to scars that are result from a lift where the lift is done from the inside without any skin tension. There's no tension on it. It's a very soft scar that just slowly over time fades. The other thing is putting the two operations together, meaning breast augmentation and the lift. They're felt to work against each other, but they really don't. You can separate them technically if you, again, respect the fascia. Put the implants behind the fascia so there's no transmission of forces onto the breast tissue, and lift the breast up and put all the tension on the fascia, which is the strength of the breast, and lift that up, and they work together. So as long as you could design the operation that way and perform it that way, you wind up having what I believe are great results that are long lasting.